Welcome to Empath. In this program, we will talk about colon cancer and the different tests for getting checked for colon cancer to help you decide which test is best for you.
Colon cancer is a very common cancer in the United States. It's the second most common cause of cancer death in the United States.
I'm a firm believer in getting screened for colon cancer because I've seen how my father suffered. He really didn't go for checkups, so that kind of taught me a lesson to be screened. You have to nip things in the bud.
Colon cancer begins in the large intestine. Colon cancer starts very slowly. They often grow within a polyp, which is an abnormal growth of tissue within the colon. But not all polyps contain cancer. Men and women should both be screened for colon cancer starting at age 50.
One of the things that helped me to choose it, as I spoke to my doctor, he told me I was over the age of 50 and it was probably time for me to do it. I would tell people to do it as early as you can.
There are two main screening tests: a stool test for blood or FIT test, which is done once every year, and a colonoscopy, which is done every 10 years. Experts recommend patients get either test because both are effective. It is important to choose the best test for you. We will now talk about the colonoscopy test.
The doctor will insert a tube about the size of my finger into your rectum and then guide that up through the course of your large intestine, the colon. During that time, they'll be looking for these small polyps that could be precursors of cancer, and every time they see a polyp, they will remove that. But in general, a person the night before, starting around 5 o'clock, the night before colonoscopy, will take a powerful laxative. And that usually involves drinking a half gallon or a gallon of liquid to completely flush out their colon.
The preparation experience was unique because you have to drink some liquids the night before. You have to, kind of change your diet and basically clean out. So that was kind of an unusual experience all night. But afterwards, it was pretty good.
If the colonoscopy is normal, it should be done every 10 years. If polyps are found, your doctor might recommend completing a colonoscopy every 5 or 3 years.
The folks in digestive health, the doctor, the nurses and all were very, very caring, very helpful, and there was no pain, and I was glad I had the colonoscopies. And everything went smoothly. It was a good experience.
Because you will be sedated for the procedure, you will need to have someone with you the day of your colonoscopy to drive you home.
Have it done. It's safer to have it done than not to have it done.
Next, we will talk about the stool test for blood or FIT test.
An FIT blood stool test, or FIT testing for short, this is a stool test that detects hidden blood in the stool. A FIT test is completed by using a kit that is provided by your doctor's office and used at home.
The FIT stool test for blood needs to be done once every year.
There's no bowel preparation needed, and it is non-invasive.
It was best for me to do it at home, and they gave me the little stool thing to take home, and I did what I had to do, sign it back. They sent me my results back, and I was happy for that.
If blood is found in the stool test, the doctor will recommend that you complete a colonoscopy.
I would strongly encourage them to do some form of colon cancer screening because any form is better than none.
We will now compare the stool test for blood and colonoscopy side by side. Major guidelines recommend getting either test because both tests do a good job screening for colon cancer. Both the FIT and colonoscopy screening tests are covered by health insurance. Without insurance, a colonoscopy costs much more. There is no risk to doing the FIT test, but if blood is found, you will need a colonoscopy. There is a very small risk that a colonoscopy could cause bleeding or a nick or tear in the wall of the colon. Because both tests are effective when done regularly, you should choose the one you think is best for you. Thank you for watching. We wish you well on the path to good health.